Thank you very much. I am Dr. Dan Eli. I am an obstetrician and gynecologist. In this week, we've been talking about cancer prevention, and the cancer of interest to us is breast cancer. Breast cancer is a very common cancer in women, and it's actually one of the leading causes of death in women in the world. Close to 2.2 million people are affected by breast cancer every year in the whole world, and this applies to most countries, developed and developing countries likewise. Breast cancer basically means that the breast has developed abnormal tissues that grows much quicker than the normal tissues within the breast. And the greatest risk factor for breast cancer is being a female, whereas men also get breast cancer, but because of hormonal changes in women, breast cancer is more prevalent in women. And oftentimes, someone can have a very long time having a breast cancer without developing symptoms such as breast lump. And that's why it is extremely very advisable that we must emphasize and encourage screening amongst women so as to be able to reduce incidences of breast cancer. Oftentimes, by the time symptoms of cancer are visible, it means that that cancer is of quite an advanced stage. And when you develop breast cancer, the cancer can spread to most parts of the body through the blood and lymphatic system. So it is extremely very important that cancers that have screening tests, such as the breast cancer, cervical cancer, prostate cancer in men, and other cancers, should be screened much earlier, so that in case you identify it before symptoms develop, the chances of treating cancer successfully gets much better. Whereas my main interest here is to be able to discuss with you the risk factors, but I wanted to briefly tell you the symptoms of breast cancer you can be able to experience. So there are a couple of symptoms that explain what breast cancer is. The commonest usually is a lump within the breast tissue. That's the commonest symptom somebody can be able to experience. But at times you can also have nipples that can be retracted or inverted. You can have skin color changes within the breast tissue. You can have changes in size in your breast. So those are commonest symptoms. Of course, those are local symptoms, but you can also have general symptoms of cervical cancer, such as loss of weight. You can find yourself having loss of appetite. You can find yourself having excessive night sweats, hair losses, and other symptoms that can come up as a result of breast cancer. So regarding risk factors of breast cancer, we categorize our risk factors into two. They are those risk factors which you have control over, which we call modifiable risk factors, and then there are risk factors you do not have control over. Those are called non-modifiable risk factors. For example, age. You may not have control over your age. Being a female, having a benign disease of the breast, family history, and then early menarche, which really refers to starting periods early, in a way can also predispose somebody to having a breast cancer. Or late menopause, that is if your periods take longer. They are generally, menopause starts from between ages of 45 to 55. So those who have menopause which takes longer to come up, or who take longer in their periods, are more likely to have a breast cancer disease compared to the women whose periods stop early or who start periods late, increased breast density. There are ladies who have more dense breast tissue. And then if you have a chest wall irradiation, it can be known or unknown. Maybe you had previously some other condition that may require you to have had maybe x-rays or some kind of a treatment that would help you. In a situation like that, you can be exposed to radiation that can lead you to have a breast cancer disease. Meanwhile, there are times when we also have modifiable risk factors. For example, bearing child, age of the first childbirth, obesity. Obesity generally refers to having weight in excess of BMI more than 30. That is obesity category 1. And I think you know why obesity is, we call it modifiable, because if you can control on how you feed and how you do exercises, in itself it can be able to prevent you from a risk of having a breast cancer disease. And then also physical activity. So just doing exercises regularly can be able to lead you into shedding weight, and you would realize that all the hormones within our body are developed from the cholesterol. So at times having excessive weight or having underweight in itself can be able to predispose us into having a breast cancer. Other modifiable risk factors such as alcohol intake, and then or hormonal therapy use. Others are tobacco use. Smoking in itself is hazardous to our body because it affects the arterial and the blood circulatory systems. So in itself also the smoke itself can be carcinogenic. So we need to guard against having smoking or being around those who smoke, so as to reduce the risk of having a breast cancer disease. Of course, nulliparity is also a form of modifiable risk factor. Nulliparity refers to people who do not have children, because when you don't have children in itself, that it's just like somebody who starts period early ends late. So because you'll be having more exposure to hormones such as estrogen, which is a very strong risk factor to leading to somebody having a breast cancer disease. So at times having conceiving in between can in itself is protective, and that is why some people ask, why is it that cancers are more common today than before? You realize that our mothers, grandmothers, and aunties of older age used to have more children, and in the process the risks also of them having a breast cancer is not as common as the women of today, who are more interested in pursuing career. Some have fewer children, so the risk of them having a breast cancer is increased. So main screening method for breast cancer disease is mammogram, but mammogram is indicated mainly in women who are at ages of 40. So the screening guidelines we have for breast cancer involve clinical breast examination, meaning that you have to go to your doctor for breast cancer examination from age of 25. The guidelines for screening really is that from ages of 25 to 34 years, we do clinical breast examination after every 3 years. In that, maybe you can go to your gynecologist or the surgeon, who should be able to examine your breast tissue and also the axillary lymph nodes, and if there's nothing, you can be able to do a screening after every 3 years. Mammogram is not recommended in this age group. Ages of 34 to 39 years, we recommend you to do a clinical breast examination and ultrasound every 2 years. And those are the guidelines we have currently for breast cancer screening. From ages of 40 to 55 years, we encourage all of you to be able to, people in that category should be able to do clinical breast examination and mammogram yearly, and that way we'll be able to catch early any changes within the breast tissue. From ages of 56 years to 74 years, we encourage still clinical breast examination and mammogram, but this time now we can do it after every 2 years. Generally, after 75 years of age, we do not anticipate any new thing would come up. And also, I think based on also the life expectancy, generally we do not usually do screening for the age group from 75 onwards. But somebody can still as well do follow-up. Thank you.